Virtual Fracture Clinic. Clavical Fracture.
Hi, I'm Tom Tressiter, an orthopaedic consultant at the Royal Melbourne Hospital. At the Royal Melbourne Hospital, the Virtual Fracture Clinic is run by specialist orthopaedic consultants and advanced practice physiotherapists. In many cases, we can review your injury and provide care without you needing to come back into the hospital. This video will give you the information you need to manage your recovery. The clavicle is also known as the collarbone. Fractures of the clavicle are common and often occur from falling on an outstretched hand or a car accident. You can expect to feel pain and may see swelling, redness, and sometimes bruising. On your X-ray, a collarbone fracture can be quite obvious to see, and although they can look severe, most will heal on their own given time and support. Your orthopaedic specialist will advise the best option for you based on your X-ray and factoring in your functional demands.
Treatment.
The most common treatment is to wear a sling for 4 weeks and limit loading while the fracture heals. It is important not to bear weight through the injured arm. This means no lifting, carrying, pushing or pulling for 6 weeks. Objects up to 250 grams, like a can of drink or a mobile phone, are okay, as long as it doesn't cause discomfort. Use your pain as a guide to how much you can use the arm in the first weeks of your recovery. It is not harmful to move your arm, though there may be some discomfort. Follow the exercises in the brochure to reduce the risk of complications like a frozen shoulder. This injury is expected to heal in 6 weeks. If you're a smoker, this can slow healing time, so we advise that you cut down or quit. You will not need to come back to hospital or have any more X-rays. It is advisable to see a physiotherapist to assist your rehabilitation. The Virtual Fracture Clinic or your GP can help you link in with physiotherapy services to progress. If after 3 months you still have pain or problems using the arm, contact the Virtual Fracture Clinic or visit your GP.
Can I drive?
You should not drive for 6 weeks, although you can be cleared to drive sooner by a doctor or physiotherapist. This can be considered only after the recommended time has passed for wearing a sling.
When can I go back to work?
Getting back to work will depend on the job that you do. A desk worker may return in a few days. Someone who has a very physical job may need 6 or more weeks off. Speak to your doctor if you need a medical certificate.
Can I stay active?
You can return to playing sports or the gym after 6 weeks. You should have near full range of motion back in the shoulder, at least 85% of your strength, and little, if any, pain. A physiotherapist can help you with a return to sport exercise program. Start with the exercises in this video.
Care at home.
Hi, I'm Emily and I'm a physiotherapist at the Royal Melbourne Hospital. We're going to talk about how to wear your sling and some exercises to help your recovery. To fit the sling, make sure your elbow goes into the corner of the pocket. Then fasten around the neck.
A model uses Velcro straps to attach the sling.
Ideally, your fingers should be slightly above the elbow to manage swelling. The sling may be removed for showering and sleeping when you are comfortable. You should make sure to rest and use the arm less, especially in the first few days. It is also advisable to use an ice pack or frozen peas over the area to help with swelling and pain. Do this for 20 minutes, 2 to 4 times a day. Wrap your ice pack in a tea towel or cloth. Never place ice in direct contact with your skin. If your pain is not improved with rest and ice, you could try over-the-counter pain relief such as Panadol or Nurofen. If you are still very sore, consider an appointment with your GP to talk about other medications. After 2 or 3 days, start these simple exercises to help your recovery. You should do your exercises 4 times a day or more if comfortable.
Exercise 1. Shoulder shrugs and shoulder blade retractions.
This exercise can be done with your sling on or off if you prefer. Keeping your arms down, gently shrug your shoulders up towards your ears, then slowly relax. Next, tighten the muscles between your shoulder blades, then relax. Repeat this 10 times.
With arm and sling, a model shrugs her shoulders up and down. Exercise 2. Finger range of motion.
Bend your fingers down like making a fist, then open the hand out wide. Repeat this 10 times.
The model opens and closes her fingers repeatedly. Exercise 3. Active assisted shoulder flexion in lying.
Lying on your back, use your non-injured arm to lift the injured arm away from your body towards the ceiling, just to 90 degrees, then slowly lower. Repeat this 10 times.
Laying supine, the model continues to raise her bent arm above her head. Exercise 4. Elbow flexion and extension.
After 2 weeks, you can add the following exercises. Bend and straighten the elbow. You may like to use your non-injured arm to assist. Repeat this about 10 times.
Exercise 5. Forearm rotation, after 2 weeks.
Keeping the elbow tucked into your side and bent to 90 degrees, rotate your palm over and back to feel a mild stretch. Repeat this about 10 times.
Exercise 6. Active assisted shoulder flexion and extension.
Use your non-injured arm to assist. Gently reach towards the sky until you feel a stretch or discomfort. You may not be able to lift very high at first, but movement will improve with time and practice. Repeat this 10 times.
Exercise 7. Active assisted shoulder external rotation, after 2 weeks.
Keeping your elbow tucked to your side, hold something light, like an umbrella or broomstick. Use your non-injured arm to help rotate the injured arm outward and back again. Repeat this 10 times. It is normal to take 6 to 12 weeks or more of exercises to regain movement. If you have stiffness or weakness persisting after that time, it may help to see a physiotherapist. You can see your own physio locally or contact the virtual fracture clinic to arrange a physio appointment at the hospital.
It's important that you understand these instructions. You're in charge of your own health. If you have any questions about your recovery, contact your GP or the virtual fracture clinic.
The Royal Melbourne Hospital.